Hello everyone. Today we will discuss about the anxiety disorders. So what is anxiety? Anxiety, it is an extreme persistence, preoccupation about some worry or fear, and it is associated with autonomic symptoms like increased heart rate, increased respiration, and increased perspiration, sweating, fidgetity, etc. So it is excessive amount of, you can say, excessive amount of your fear or some worry with your arousal symptoms. So why that happens? It is due to an excessive arousal in a person. So let's recapitulate with the graph which we have discussed previously for effective functionality. So this is the efficacy or response of a person, or you can simply say the functionality of a person, efficacy or functionality. And this is the level of arousal on the horizontal line. This is, you can say, arousal. So this is low side, this is high side, and this is less amount of active functionality, and this is your maximum amount of functionality. So what is usually seen when we study the functionality associated with the arousal state? So it is seen that there is an inverted bell shape kind of a curve that was seen. This curve was given by Dodson. This was given by Dodson. This is also known as your Dodson curve. So what happens here is that it is seen that maximum efficacy, it is seen at this level. So we see that below this arousal state. So this is the optimal level of arousal in any person. So once a person is aroused to this state, then there is a maximum efficacy that is seen. What happens below this state is that person would be feeling low, depressed and lethargic. So this, if under arousal is there, then it is kind of a depressive state that is seen. So it is kind of a depressive state a person is seen in on under arousal. This is your under arousal. And what happens if a person is aroused beyond the optimal requirement? So this is at the state of your over arousal that we see person would experience state of an anxiety. So what happens here is extreme stress is there and extreme anxiety the person will be feeling, and this will in a way affect the efficacy. So from a good efficacy or functionality, person has reduced to a lower efficacy. So it will affect the functionality of a person. So at this state where there is a hyper arousal state, it is an anxiety like state. And the concept of this was given by Dodson, the functionality and association of arousal state. So this is the Dodson curve. So let's discuss the further various anxiety disorders that we'll be seeing now. So various type of anxiety disorder we'll be dealing one by one. So first let us start with your GAD, that is your generalized anxiety disorder. It is generalized anxiety disorder. So what happens in GAD, generalized anxiety disorder? It is a state where a person would be having a free floating, generalize it like it is throughout, without any specific situation or place. So it is generalized, present throughout the state. So a state of anxiety is present throughout. So it is a free floating anxiety. So what are its features? We will see the clinical features of generalized anxiety disorder. First, it is a key word here. It is a free floating anxiety that is present. So it is free floating anxiety that is present. Second, it is a continuous muscle tension or motor tension, restlessness a person would be feeling. So motor tension, or you can say restlessness is present in a person. Since there is a continuous tension present, so person won't be able to relax. So it is an inability